did you want to make the comments?
The amendment is, through the chair of the member opposite, the amendment is proposed as certainly a friendly amendment to the government side.
Thank you. Any questions, comments regarding? Seeing none. Is it the pleasure of the committee to adopt the amendment? All those in favor, please say yea. Yea. All those opposed, please say nay. In my opinion, the ayes have it. I declare the amendment carried. Yep. Any other questions or comments, concerns? To recognize the member for Fredericton Grand Lake and leader of his party.
Thank you, Mr. Chair, and thank you, Minister, for being here today and speaking on Bill 11. There's no question this is quite a highly controversial bill that's been brought forward, and you know, I guess I'll start by saying I don't question the intent of the minister by any stretch on what he's trying to do here. You know, I think like everybody else in this room, you know, we believe in the medical science and effectiveness of vaccines. Most, if not all of us, are vaccinated. I know I am. My children are and will continue to be. But like many others in this room as well, we do have very serious concerns with the overreach of government and where it stops. And I guess at the very heart of my issue is the need for such a bill, especially when we have so many incomplete files. So I represent the riding of Fredericton Grand Lake, and I took some time to tour the schools in my riding. And I can tell you that the schools that I went to, the Gibson Neal, Minto Elementary Middle School, Minto High School, Chipman High, Chipman Elementary, you know, I just inquired about, you know, obviously how things were at the school and some general questions, and I kind of prod a little bit about the need for Bill 11 in terms of vaccination for children. And I requested how many exemption forms had been filled out. And the number that I was able to come up with in my request to the schools throughout the riding was less than half a dozen. And we're talking hundreds, you know, of students going to all these schools and less than half a dozen. Of course, there was no privacy breach. We didn't ask for any names or anything like that. It was just a ballpark figure from school to school, how many exemption forms have been filled out. And that, I guess, for me is the heart. So I know this has been asked before, but I'm going to ask it again for clarification. There is 2 districts, my understanding is, that do not have files completed. Taking those 2 districts out, how many exemption forms have been completed throughout the remaining districts in the province?
Through the chair of the member opposite, just getting that information. Be with you just 1 second as soon as the voice in my ear starts speaking. Member opposite, or member alongside, 1,311 currently, excluding the 2 districts. So that's approximately 1% of the total population of the school, student population of the whole province, including the districts that have yet to report any data at all. So, but I want to reiterate, for ceding the floor again, because the honourable member from the official opposition and from the honourable member who's currently asking questions have asked questions around this data. And I'm not sure how many times I have to repeat this. This bill is not about that. And I find it difficult when folks are trying to say, yes, we support vaccines, yes, we support vaccines, and then continue to cite something that is not actually the intent of the bill. The intent of the bill is to make sure that we eliminate religious and philosophical exemptions because they're inappropriate for the reasons that I think I've discussed at length publicly and here in the chamber. And the point of the record system that we have in the schools is to make sure that we have an up-to-date record system in the schools. These are 2 separate issues. So, honourable members, it is difficult to hide behind a claim that you are supporting a vaccine system if you continually refer to something that is literally not the subject of this bill.
Nobody's hiding behind any claim, Minister, and I find it frankly insulting that we're asking direct questions on a direct bill about vaccinations. And a direct answer would be good, but you can't give direct answers because you don't have any data, is the bottom line. So let me ask again. In terms of the exemption forms, 1,311, which are incomplete, how many of those 1,311 are due to religious exemptions or conscience exemptions?
Sorry. That I gave a very specific 1,311 answer to the data that we currently have, and the reason we don't have the other data is not because of any negligence in the department at this point. When I first took this job, within a few weeks we started that process of making sure that data was begun to be collected. Public health has limited resources and took them a while to do it, and they're still working to finish it up. So that is the full piece of information in terms of the number of exemptions. The rest are now waiting again to be processed by public health, having already been completed by the Department of Education. So as soon as we get that, I'll share that obviously with everyone. But on the specifics around religious versus philosophical exemptions, that data, the question had previously been asked in the questions from the honourable member opposite last week. We don't track the difference. That's part of the problem, is that there is no separation between religious, philosophical objections. And again, many people with medical exemptions write out the medical exemption without going through the paperwork, because this opens this large loophole. So we don't separate that data out at this point.
Well, I would say that's problematic, because that's important. I would think to know, what are we looking at here? If we're staring down a health crisis in our school system in terms of vaccinations, I think we could be having a different conversation. But based on the data that I'm seeing here, and the fact that it's incomplete, and the fact that we don't even know how many are because of people's conscience or religious reasons don't want to have their kids vaccinated, or medical, we don't even know the difference. It could be 1,300 of those are medical. Maybe only 11 are due to religious, philosophical reasons. Should we be putting a bill, cramming it down people's throat for 11, for 10, for 50, for 100? I mean, where do we draw the line? So I think the data is important. And you had mentioned, Minister, that that this is not the reason for the bill, but I'm quite certain that originally when the bill was presented, that was used in terms of the need for the bill. So I'm just wondering what has changed between the original presentation of the bill and where we're at today in terms of that data not being relevant, according to you.
And the reason that we collect medical records is on one side, and that's an important part of, it's just a public safety issue, a public health issue, of course. The reality around religious exemptions is that, as I've mentioned a few times, there are no religions that have religious objections to vaccines. There have been small communities influenced by anti-vaccination organizations from religious communities. I'd use an example of the Hasidic Jewish community in New York City, and there was a couple of communities there where you had organized groups go in, convince folks in those communities that there was an effort to target them because of their religion, and you had local religious leaders taking that position. But there are no faith groups of any size or level of recognition who are opposed to vaccines. So that's just a statement of fact around the reality of that particular issue. So on the religious side, that's not really the concern. It's around the philosophical objections, which I recognize are there, but again, I would argue are not sufficient to allow for the continuation of that exemption, given the actual harm caused to vaccine to immunocompromised children across our system, of which we know there are numbers. Several of them appeared and gave testimony last summer at the committee hearings and have made their views public in various forms. So you asked about the changes. Well, this is the second iteration of this bill, but from the outset, having had a concern over the rise of anti-vaccination movements for a number of years, when I came into this job, I asked the department about where we were with the vaccine system and found out that we had this somewhat odd system of not differentiating, completely agree with you on that it's odd, between religious and philosophical objections that had tended then to bleed into folks being able to use that to get medical exemptions as well, because we've talked before about restrictions in our healthcare system that folks rather than going to a doctor, would just say, well, I don't want my child to be vaccinated, and that would be sufficient, which I think is unfortunate. But there's been no change. Certainly after this government came to power, there was a measles outbreak which attracted attention around the issue of vaccines. But discussions around this bill had begun, I believe, in November of 2018 with myself and my staff, my political staff in that office. And so nothing has changed. It's just that since then we've seen a number of examples of why bills like this are important. People with incomplete vaccinations. In Italy, when they introduced a mandatory vaccine law, a lot of people came out and said that, well, you know, once we found out this was mandatory, the government took it seriously, we went and made sure we got our shots done. And every time these issues turn up, they tend to drive up the number of people who actually get their shots, because most people support mandatory vaccinations and support the vaccine system. So in terms of the issue you mentioned around why are we doing this now when we have a crisis, when we don't have a crisis, first off, we're not far away from one. With a vaccine failure rate, or not, some people don't take up the vaccine properly when it's given to them, which is just, that's normal and known. There's nothing wrong or nefarious about that. But that can be up to 3% of people who vaccines just don't work for whatever reason, or they can't have them. So you're down to 97% automatically. And 95% is the point at which you lose herd immunity in a population. So if you are then 2 points away right now, we know we're already 1% and a bit away from losing herd immunity. And further to your point, we've just seen the consequences of a world that didn't bother to turn on the fire extinguishers until after the fire had started, with the way that COVID-19 preparations had been left in a disastrous state across the world, that we weren't prepared for a pandemic. In this case, we have got the World Health Organization saying this is a crisis that is coming down towards us. This is something that is going to cost lives and is going to ruin societies. And we've seen limited outbreaks in different places as vaccine rates have been pushed down by organized anti-vaccination activists. And the result of that has been death and sickness. And why would we not do the prudent thing? I always used to compare this to the environmental argument, where we decide that we are going to take steps to address catastrophic climate change before it becomes catastrophic. Surely, in 2020, the last thing we want to do is to wait for another catastrophe to become a catastrophe. Let's stop it before it starts.
So, if we're talking about Bill 11 in terms of mandatory vaccinations for students, which I think it has to be cleared up that vaccinations are mandatory now. There's just a process by which some parents who object can go through an application and exempt their kids, right? So that's important that people understand that. This isn't a debate of mandatory or not mandatory. This is a debate of whether those exemptions should be removed or not allowed in the first place. That's the key. So with that in mind, I guess the question I would have, I'll just drive it home. I mean, we've got all kinds of emails, phone calls coming in regarding the bill. Some of them are clearly anti-vaxxers, which we get. There's others who are pro-vaccination but have serious objection to the infringement of rights and the infringement of parental rights, which is very big. I'm a father of 3. Like I said, all my kids have been vaccinated. I talked to one mother here a couple weeks ago, and she has a couple children close in age, and she had one child vaccinated. It didn't go well, and now she's going to be forced with her second child coming into school to get him vaccinated. And as a parent, putting myself in her shoes, even though, you know, there may be some debate around the vaccination and the harm it caused the first child, yes or no is part of it. But as a parent, if as a parent you're convinced that the effect of the first child was because of the vaccination, even if it's not true, it's really hard for that parent to then turn around and vaccinate their second child into the school system, and for the state or the government to force them to do that when we're not even in the middle of any type of health crisis within the schools. I can understand that. I can understand that. So I guess my question is, for the parents out there that are like that lady, that for similar reasons, maybe it's misinformation, maybe it's their own conscience objecting, whatever it is, but they choose not to vaccinate their children, where does that leave them if this bill passes?
through the chair to the member. First, I mean, we certainly have received thousands and thousands of emails. It's one of the reasons this issue has become contentious. And one of the first things that folks who write emails to legislatures are encouraged to do, and you can go to any one of the anti-vaccination sites or the many pro-vaccination sites that talk about how to identify an anti-vaccination campaign, is that people will say, well, I fully support vaccines. I've got vaccinated because, of course, we mostly got vaccinated when we were kids and didn't have any say in the matter ourselves because our parents made that choice. And it was also a nearly universally accepted idea up until quite recently. So just caution against saying that a lot of the folks who've written in talking about how they are in fact strongly supportive of the vaccine system, if you do even a little bit of digging, which I've certainly had my staff do to try and go back through a lot of the folks who write in, they are members of active anti-vaccination organizations which recognize that the best way to gain support is by saying, well, of course we're not questioning vaccines, because that wouldn't make any sense. Again, the WHO has been pretty consistent in talking about this and encourage members who are interested in the file to look at what the WHO has said about the dangers of the anti-vaccine movement, because I cannot agree with the honourable member that this is not an issue. We've seen rising numbers of anti-vaccination organizations. We've seen them here outside the legislature. The fact of those groups' existence and presence is evidence of the reason why we need this bill. Because when you talk about parents, it is one of the things that I find most reprehensible about these organizations is that they take in some cases, traumatic experiences of parents who've experienced injury or death for their kids for any number of different reasons. And they say, oh, well, again, I can offer you an easy answer to why this has happened. And they say it's vaccines. And there's no evidence for it in nearly all cases. The rates of vaccine injury are so vanishingly rare that to just have a discussion that includes the risk of vaccines as a relevant component is itself to give credit to the organizations that are spreading this misinformation. And so what I would say to the parents you're talking about is that they should talk to their medical professional, because there is a reason why we have the medical exemptions. And if they believe, and there is a medical reason to justify a medical exemption, they should get it. Because there are some people who should not be vaccinated, and some people who can't. Kids who've got cancer, kids who are going through different courses of treatments, and kids who've got suppressed immune systems. But what I would say to those parents as well is that their fears being stoked up by some of these groups are also not a sufficient reason to endanger the children of other parents who, through no fault of their own, are vulnerable, and to the broad mass of the population who are relying on herd immunity to make sure that we can continue to be protected against incredibly dangerous, highly transmissible diseases like measles, which is much, much more dangerous and easily transmissible than COVID-19, which we just shut down the entire world for 3 months to deal with. So this isn't an abstract conversation. And I would also argue about, if you're going to discuss parental rights, we impose rights, reasonable limitations on rights in our school systems already. We do not allow children to go to school with guns, regardless of the fact there actually are some religions who have the ownership of self-defense, firearms and other weapons as part of their ethos. We have routine restrictions against people wearing perfume, eating peanut butter, eating shellfish. And we accept all of those because to go against that is to endanger some kids. And so what we're talking about here is protecting as many people as possible. And if there's a genuine reason to not get vaccinated, that is a genuine reason and it should be respected. And that, in fact, is the whole reason behind the bill, is to, first and foremost, protect those kids who don't have an immune system that's protecting them. So they rely on the rest of us to do that for them. And I think it's appropriate to make sure that we stand up and say that's what we're going to do, because they're not making a philosophical argument or having an ideological debate. They're sick, their immune systems don't work, and if they're exposed to someone with one of those diseases that we can easily prevent, they can get sicker and die. And I'm not willing to do that on my watch.
Okay, so with the kids, or the parents, I should say, that this bill passes and the parents still refuse to vaccinate their kids, any backup plan for them?
Last half of the sentence, I apologize.
No, I'm just saying for the parents, if this bill passes and the parents that do not vaccinate their children, what is the backup plan for the children's education going forward?
They will be choosing to take themselves out of the public school system, the same way that a parent who chose that they were insisting that their child have the right to take a knife to school or to eat peanut butter in school are also asked to leave the school system, that it's a choice. And I've been clear from the outset that this is a question of a balance of rights, because right now we have the rights of actual sick kids being compromised today. September, they won't be able to go back to school unless we have proper protections in place. And so it's comparing an actual concrete harm against a harm that comes from mistaken ideological belief that is not supported by evidence. It's not real.
So the immunocompromised children, you say that are not going back to school. So this bill looks after all the students. But what about the teachers? What about the bus drivers? What about the EAs? What about the Breakfast Club volunteers? What about parents coming and going in and out of the school, picking up their children? Grandparents coming and going out of school, picking up their kids? The public coming in general? What do we do with those?
It's again a question of doing the best you can with what you have, and just like we went through with COVID-19, I apologize through the chair of the member, that we've just gone through a process, for example, with the bubbles for around COVID-19, with a recognition that people are going to have exposures, and as we further loosen things up, people will have further exposures, which absolutely further limits the impact of those restrictions. This is a reasonable restriction, again, that would bring benefit to kids inside the school system, because outside it's their parents' responsibility as much as possible to look after them, and they do. And in some cases that's very difficult, but the least we can do as part of the public school system is to protect the general public against transmissible diseases. And when it comes to the adults in the system, the issue is most people, to your point earlier around how most people are vaccinated, especially as they're older, this is largely a problem of new vaccinations or booster shots with young people. And while I would certainly love to see everyone getting vaccinated, that's beyond my scope as minister, and I have no intention of trying to overstep my bounds in that respect. This bill is consistent with a lot of other bills in other jurisdictions across the developed world, and those have restricted themselves largely to students, although in some cases they have gone further, but that's not the scope of this bill.
So if the principle remains the same, of the importance of vaccinating students in schools, I mean, you can't divert away from that. You would have to, again, vaccinate mandatory, without exemptions, all your staff, all your teachers, all your bus drivers, all your EAs, all your volunteers, people coming in and out of the school. I mean, because again, if you want the same thinking of principle, everybody in the school, Department of Education, and anybody being part of it, picking up their kids, should have the vaccination mandatory without exemption. The issue I have is, where do we go from there? If it works in the Department of Education, and if we force that on students and parents and teachers and volunteers, wouldn't the same principle apply to the Department of Health? Should all nurses, doctors, janitors, staff members, mandatory vaccinations in order to be employed? Should it work for every civil servant in the province of New Brunswick? I guess, and I know this is your bill for education, but if the ideological viewpoint stays the same, it's a slippery slope. I mean, in the end, we're saying, why don't we just make mandatory vaccination for every citizen in the province? So is that something that you think would be feasible?
Through the chair of the member, you're building on multiple layers of hypothetical questions there. That's not what this bill says, and not what I'm here to defend or argue for. So I'm not going to get into talking about hypothetical situations. I mean, I'm happy to discuss that over a coffee about my feelings on broad vaccination policies, but this is a specific bill around how it affects students inside the public school system in the province, and that's it. I am. It's far beyond the scope of this bill. This bill is about public school students enrolled in the public school system and in licensed early childhood education centres in the province of New Brunswick.
It may be beyond the scope of the bill, but it's certainly not beyond the scope of the principle of the bill. And therein lies the issue. How far do we go? And again, if this passes, then what's next? I guess what I'm saying is, what I would recommend, strongly recommend to the minister and to the government, get the data together, get it fully collected, understand where we are in terms of herd immunity, understand how many kids we have that are immunocompromised, understand how many of those exemptions that parents fill out are medical, legitimate, and how many others are due to religious or philosophical reasons, reasons of conscience, and get the information out. So then we as legislators, I mean, you're asking us essentially to violate parental rights protected, as noted here many times, under the Canadian Charter, and you, Minister, have even said you understand it's the rights of the immunocompromised and the rights of those that refuse to get vaccinated. But you're asking us as legislators to infringe on those rights without complete set of evidence, data, and that's why I believe it is critical that we do one step at a time. Let's see the evidence. Let's see that we are losing herd immunity. Let's see that we are coming up to a potential health crisis. I'm even in favor of getting ahead of it if that's what it takes. But I don't see a complete picture here, and I'm really hard-pressed to vote in favor of a bill that bars people's rights, parental rights. As a parent myself, I can't do it. And again, and I understand the intent, I do, but I don't know why. I'll ask the question. Why, Minister, wouldn't you take the time to get the information collected, find out how many kids are immunocompromised exactly in our province, how many kids or parents use exemption forms, how many of those are medical, how many of those are religious or conscience reasons, get all that data together, then come and present a case before all of us to be able to determine which way to go. Why wasn't that done?
Through the chair, the member opposite, I'll repeat again that that is not the intention behind this bill, that I immediately moved to strengthen the existing structures that had been left in disrepair over multiple decades, really. It's a long time since they started to fall apart based on what we've been able to trace back through the system. Immediately moved to get that data set repaired and up to date and accurate, and that's ongoing, and again would have been complete if it wasn't for COVID-19, which was obviously beyond all of our controls, but is still an interesting point to again look at the impact of a single disease without a vaccine when we're having a conversation about vaccines. So that's why, because this bill is not about that. This bill is about the World Health Organization saying that anti-vaccination movements are a global health threat. It's about the fact that we see evidence of that around the world, and here in Canada, we are seeing that here in our own province and on the steps of our legislature. And when you talk about a slippery slope, it's kind of interesting because there's been a cycle of anti-vaccination movements back and forth over the last 200 years. So when the first vaccine was developed around smallpox, there were a lot of the same concerns raised about infringements of rights and so on. Some points in history we've had mandatory vaccines. We've had them for our forces. We continue to have them. You raise doctors and nurses, they already have to be vaccinated. So those limitations have already existed in places where it seemed to make sense for those limitations to exist. And in this case, given that children are the most vulnerable to a lot of the diseases that we have vaccines against, that's the impetus behind this bill. So the evidence is there. The evidence, and I've shared it in this legislature, in the media, and I'm happy to share volumes of it with anyone who's interested in reaching out to me on it before the final vote on this bill. But the evidence is clear that mandatory vaccination bills, and I appreciate your precision there around how the fact we already do have the vaccine mandate, it's just we do have an incredibly broad exemption where you can literally just write no want vaccine, and that would be a sufficient reason for the department to accept that there's no qualifications attached to how those vaccines are put, the vaccine exemptions are formulated. So that is the problem here, is we've seen that this is a tool that works in countries that have introduced mandates and removed the philosophical objections. We've seen rates of immunization go up by, some cases, over 3%, and that will protect some of those children. Because again, you talk about violating parental rights. What about the rights of the children who are sick today? And I believe, if I'm to take you at your word that you do believe the science behind vaccines and believe that they are generally safe and effective, in that case, we are talking about actual harm to actual children right now versus an ideological concern that is not based on science, but is being amplified intentionally by, in many cases, bad actors and organizations that certainly don't have the best interests of New Brunswickers at heart.
So, just so people that may be watching this or the public at large can understand, can you explain, Minister, how vaccination program works now? Like, you know, my mom's generation would go to school. When they were at school, they got their vaccination, they went home. How does it work now? Do kids, is there any vaccination programs in the schools now? Do parents have to sign off to allow their kids to get vaccinated? Can you just kind of break down exactly how it works now?
And through the chair, thanks to the member for that question. Just to make sure I'm being clear that just the vaccination process as it applies to kids in the public school system, not the broader. Okay. Just give me 1 minute because I'll make sure I get the stats for you. To the member, my terrible writing here. So the first thing that you have to do, so when you have your child, so this is for New Brunswick students, so if your child is here before they start school, so there's some 2 streams here. So if they're here before they start school, they go and get their shots either through public health, family doctor, whatever other, just through a medical professional, which is fairly easy to do. And after that, you have to provide that registration form. So you get your little green card, the ones that we always lose, and you provide that to the school. And then once you've given that to the school collects the data and then passes it on to public health, who then goes back and verifies the data and basically says, okay, you know, you were supposed to get the following shots. Did you get these ones? Maybe you missed one. If you missed one, they would write a letter back out to the parents and say, you've got the following gaps in your required immunizations. Can you please get them up to date? You've got 120 days to do that. If the kids are coming in from outside the province, from other provinces or countries, they've got 120 days from the time they register to provide the information, that basically goes through the same process. If they're applying for the exemption, they would do that at the outset and saying, we're using the clause that allows for religious or philosophical exemptions, or for medical exemptions, which would also then be verified through the same mechanism by public health and the system.
Thank you, Minister. So just so I'm clear, so there are no vaccinations that take place in schools?
The chair to the member, there are clinics in the schools of grades 7 and 9, but they are not for the mandatory shots. So those offer for HPV and other shots, which are optional. So those ones are offered in school, and that's a change from, because I remember when I was a kid long ago that we got some of the shots in school itself, which was an era when public health had a stronger presence in the education system directly.
Yeah, I knew the answer to that because my son is right in that, well, he was in that age range. He's growing much quicker than I think he should, but it's all part of being a parent. So then there are certain vaccines that are given in schools, and I don't remember as a parent in that time signing any form or anything, you know, to allow him to have those vaccinations. Are those forms in existence? Are they required, or can they just vaccinate the students without any signed parental consent?
The member opposite, so I can get the detailed answer there, but those vaccines are not part of the scope of this bill, so happy to provide the information, but they're not part of the scope of this bill because they are not mandated vaccines. But I'll get you the details on the process in 1 second here.
These aren't part of the bill, but the bill doesn't specify which vaccines are going to be mandatory. But I should rephrase that. My understanding is it allows for the Executive Council or Public Health to expand that as well. So you could increase vaccinations mandatory in what's currently in the bill. Is that correct?
That is, through the chair of the member, that's correct, but that applies to absolutely anything that government, the legislature is sovereign within the limits of, you could have something that was introduced and then challenged in court, but this bill is this bill, that hypothetical other bills that would introduce mandatory other vaccines, it's not, that's not, I can't really speak to hypothetical things. Yes, a future government could do all sorts of things. A future government could decide to abolish all vaccines, make all vaccines mandatory. This government is working to make sure that public school kids and those in licensed early childhood education centres have the list of vaccines that, to your point earlier, are already mandated, and simply to remove the philosophical objection. And but I'm happy to get the answer on the question about the forms if you're still interested. I have to go and talk to the people in my ear for a minute.
Sure. Thank you, Minister. Oh, yeah, okay, go ahead. Sure.
Health program again, so it's but happy to, we do have the information on it. And so what would happen is you would get, the students are given a letter to bring home, and it has to be signed. Or you can obviously refuse to sign it and send it back with a note of objection or saying you don't wish to take advantage of it. But unless there's a signed letter, you would not be able to access those vaccinations, which, again, important to reiterate, are not mandatory and are not part of this bill.
Thank you, Minister. I'm always trying to find the alternatives to certain legislation that's being presented that I'm having a hard time swallowing. And I'm wondering, with this bill, have you looked at alternatives in the sense of, instead of completely removing religious and philosophical objections or exemptions, making it more difficult? So if I'm a parent that is absolutely adamant that I do not want my child vaccinated, that it's going to make me do a little more work to ensure that is the case, as opposed to, just simply coming in, signing a quick form and carrying on. Have you looked at other alternatives? Maybe the exemption, to ensure that it's signed correctly and that it's authorized. Maybe take it to a Commissioner of Oaths for for verification, or just make it a little more difficult. That way, in my thinking behind that is, it would show where parents really are, and those ones that are absolutely adamant about this, which I think, and I firmly believe, are very few, very small. But is there a way to make the system a little more difficult, that they would have to go through a little more of a rigorous process to be able to get that religious or philosophical exemption?
So through the chair to the member, first appreciate that sentiment, because trying to fix this is, I don't for a moment think this is an easy discussion, and I think that's one of the reasons why it's a free vote for all parties, is that this is one of the more complex moral issues that we've had to face as this legislature since the last election. And I certainly did look at those. So ranging from exactly the sort of options that the honourable member is talking about, where you would have just, like you said, just making it harder. You'd make it be a checklist of things. Can you tell us why you're choosing to object? Can you tell us what the reasons are? Can you provide having a range of questions with blanks left open, so the parent would have to fill in some descriptive reasons about why they're taking the choice that they were making. And all the way up to, as I mentioned in the conversation with the honourable member from the official opposition, the idea of having education programs, which certainly as someone who's generally in favour of smaller government, I'm always looking for ways to try and figure out how we can not force people to do things, that the best way to gain consent is to gain consent. And unfortunately, the evidence is very clear on that those don't really have any impact at all. The only area where there's a positive impact would be in New Brunswick, if you introduced a requirement that says that if you were going to use a medical exemption, that you actually have to provide the medical arguments for it. But that's very difficult, because if we're going to let people have an unrestricted philosophical objection for whatever reasons, because as you would have known from having received a lot of the emails I get on this, people come at this from all sorts of different angles, and the reasons why they might object to it can be incredibly strongly felt, but for reasons that have got very little to do with each other. That the constellation of anti-vaccine causes and activists is pretty broad and wide. So the evidence is pretty clear that it just doesn't really work, and that what does work is a mandate and a removal of philosophical and religious exemptions. And again, I strongly support the removal of the religious exemptions, because those were simply included because someone felt shouldn't we say religious in addition to philosophical? And there are no religions that are opposed to vaccines. So a religious objection where no such objection could legitimately be made surely removing that at least makes it clear what we're dealing with here, which is medical objections and philosophical objections, which are the two valid reasons, or the two reasons that had been considered valid by the system. So it's the evidence is clear that mandates drive the numbers up, usually by around 3%. And I think you're quite right that at this point we don't have an enormous number of anti-vaccination activists in the province, but they're growing all the time. And again, if you go and look at the information from our security services and others, that the data is there around the growing influence of these groups. And again, the fact that they are dangerous and pose a risk to public health. Not because the parents who we've heard from and have talked to and sometimes are bad people at all, but there are some bad actors who are manipulating and influencing people. And the consequences of that are going to be felt not just on their children, but on yours and all the other children in this province, and the rest of the vulnerable people in this province who we've been in the midst of setting up enormous and complicated structures to try and protect, including the way that we're operating this legislature. So to me, it's an extension of the same basic principle around we should do what we need to do to make sure people can stay safe and healthy to enjoy the freedoms that previous generations won for them, including Canadian service people who also have to be vaccinated.
Thank you. I'm just thinking to myself, I know running for office, there's several forms you have to fill out. A lot of things you do require like a commissioner of oaths, and I know how inconvenient that can be, you know, lining one up, going to them, presenting the application, doing the sworn affidavit, whatever, and getting the form filled out. And I'm just wondering if something of that effect could be used to say, yes, those exemptions will remain, but you know, again, either you need both parents to sign, or if there's only one parent, you know, again, a commissioner of oaths or something, to make the process a little more rigid, so it's just not this easy peasy walk in, fill out a form, walk away. It makes the parent think a little bit harder about what they're doing, and I think at the same time it would help the education system, you know, kind of stress that importance, and that you know, as a parent, you really need to think about why you're choosing to go the route of the exemption and just making it a little more rigid. Has the Department of Education looked at anything like that in terms of like a commissioner of oaths signature to coincide with the exemption form?
Again, through the chair to the member, those methods have been looked at in some places, and I appreciate earlier you were talking about the importance of looking at data and evidence on this. And there's a lot of data and evidence around different efforts that have been made in some American states where there's real concerns over, given the American cultural tradition around civil liberties, about how these sort of laws could infringe on those liberties, about trying to move in the sort of steps that you described. And they haven't worked. And what they've tended to do actually is to produce the opposite effect, that they reinforce anti-vaccination sentiment, which is the only reason why I support a full mandate, is because anything up to but not including a mandate generally results in an increase in both anti-vaccination sentiment and levels of organization. That's been shown fairly consistently, and I think I used the example. I apologize if you heard this from me today. If you did, just nod and I'll be quiet. But the example from Ontario, where they set up an education system and it had a 0% success rate, where the parents had to go in and talk to someone about, I believe from public health, about why vaccines were important for their kids. So these are people who had used the philosophical exemption available in Ontario, and not a single parent changed their mind as a result. And what it did instead was fuel another wave of angry online sentiment, where this was seen as being, look, it's the Stasi. They're dragging us in now. It's Big Brother dragging us in, trying to brainwash us to hurt our kids. So it's unfortunately, some modern conspiracy movements, which during the course of the last couple of months have in many cases come together around a whole range of odd subjects, but definitely including anti-vaccine sentiment, is they're largely immune to outside pressure or evidence or a reality-based approach to argument, because the position isn't supportable on any of those grounds. So I don't take this stuff lightly, but it's really the reason why the option was presented as it was in this bill, is because that is the only mechanism that's been shown to have consistently positive effects when it's been used in other jurisdictions. So if the commitment to evidence-based decision-making is there, that was the evidence that was used. So I can only say that.
Thank you, Minister. Any other province in Canada have a bill like this?
Or through the chair to the member. Not at this point. It's being there's one being discussed in Nova Scotia, and it's we're certainly. Now, of course, I've got someone calling me on the other line while I'm listening to the team on the phone. That it's being looked at with interest what we're going through here in New Brunswick and other provinces, because other provinces have larger and faster-growing anti-vaccination movements. And so, some of the discussions with other colleagues across the country, I know there's keen interest in seeing where we land on this, because there's a fear that we're about to see institutions such as the vaccine system being substantially eroded over, I think, in the end, a rather artificial discussion over rights, given that we are talking about actual rights of actual kids for actual reasons being infringed upon right now. This isn't theoretical or ideological for them.
Thank you, Minister, for those answers. Again, I certainly don't take this bill lightly. I haven't when it was first introduced originally, and I certainly don't now. I've heard a lot. I remember when the bill first came out in its original form last fall, all the emails, we were just bombarded with emails. And as I started going through them, you know, you see the vast majority of them are from California, Ontario, Wisconsin, you know, everybody but, you know, very few New Brunswickers at that time. But I have seen a shift, and I've seen more emails coming in, even from my own constituency, which I hadn't heard anything until about the last several months about, you know, this bill and the people in my riding. And I've heard from all kinds. I've heard from some that, you're right, have that anti-vax sentiment. But I hear from a lot that are kind of in my frame of mind where they are vaccinated to support the science of it, but they just feel like it's just too much of government overreach. And I worry that, and I've even worried with COVID-19 and some of the things that, you know, when I sat on the cabinet, and some of the decisions that were made were tough decisions, because you're really restricting people's rights in certain areas. And, you know, in extraordinary times, you know, sometimes you can bend a little bit for a limited, temporary, momentary time, but I'm very much the type of person that believes in limited government and limited overreach of government, and that's why I'm really struggling with this bill, albeit understanding the intent of it. So again, Minister, I appreciate you answering my questions, and that's all I have, Mr. Chair.